Right, so first I'm going to start off with showing you my research binder that I compiled. The first one we start out with, the first tab is vertebral subluxation with a research article about it. Next one is wellness development care. I have an article behind that one. And then we move on to subluxation condition-based care with a couple articles behind it. We move on to chiropractic spinal tab with an article behind that one. The next one is the functional neurology in chiropractic. And then current mechanical system. I found a randomized clinical trial for that one. Bad medicine. New vitalistic system. And then my second binder, the office binder, has the pre-visit information in it. And then we move on to visit 1 information. And then information for our healthcare class. And then the report of findings, the progressive exam, and then any other pertinent information I felt that needed to be included. Alright, so, good morning, I'm Dr. Ali. What's your name?
Ben.
Nice to meet you. I see here you filled out your patient history, and I see that you fell off the surfboard and hurt your back. Can you explain a little bit more about that for me?
Yeah, so over the break, me and my family took a trip to Hawaii, and my kids suckered me into going surfing for the first time, and let's say it was not successful. So fell a little bit and hurt my left leg, and feel a little numbness and tingling down there.
Perfect. Okay, so you're here today for visit 1, so we're going to complete our initial exam. So today I'm going to have you do 3 types of exams. The first one, you're going to do a physical exam, which includes your paperwork, your patient history. The second one is the chiropractic exam, which will cover the 5 components of a vertebral subluxation. Have you heard of that before?
No, I haven't.
Okay, well, it's where the bones in our spine shift. They impede the spinal nerve from transmitting 100% of their message to the rest of the body. And these altered messages, which we call in chiropractic as interference, can lead to a range of health issues as pain, disease, and even cancer. I will explain all this in more detail later in our healthcare class, and I'll explain how you have to attend one of those. And then the last exam we do is x-rays. So we will be doing x-rays of your full spine. These are really important to allow me to assess the health of your spine and locate any issue that I find. Do you have any questions?
No, I think that sounds pretty good.
So before we start the exams, are you comfortable moving forward with these exams and discussing possible treatment options?
Yes.
Okay, perfect. Let's begin.
Okay.
Alright, so now tomorrow. Alright, welcome back. How are you today?
Good. Thank you.
Still having the pain?
Yeah, the pain's still going down my lower leg and down my left side.
Okay, so any new complaints since yesterday?
No, just my leg.
Good. So yesterday I reviewed your exams and we have a few things to discuss. Your mechanism of injury that you described yesterday from falling off your surfboard with pain in your lower back and having tingling and pain down your left leg is something that we can definitely help you with here. As you are aware, we took 3 sets of x-rays covering your cervical, thoracic, and lumbar pelvic area to see all the areas that we can correct. And here we do more of a full spine approach where even though you might have pain in one specific area, that might not mean there might be another issue somewhere else. So here we have the 4 stages of degeneration, and we'll go over these stages in much more detail in our healthcare class. But I just wanted to go over them quickly today so that you understand. So here in the normal one, you can see there's a nice cervical curve. We want to see equal disc spaces, and you see how each body is equal spacing. And all the vertebral bodies look the same color. Not one's less white, not one more white. And this is pertaining to the density, the bone density. And you can see there's no lipping or spurring, and the angle of C1 is not compressed into your skull. So the good news is you're not in phase 4, but what phase do you think you fall into?
Right around here.
Right around there, so stage 3. Well, I wouldn't put you quite in stage 3. I'd put you between 2, maybe slightly stage 3. But as you see here on your x-rays, you have a very straight neck, something we like to call the military neck. Your atlas is angled down like a plane landing. This is putting huge pressure on your spinal cord, interfering with messages trying to get down from the brainstem. And you're probably not even aware yet of the symptoms that this could cause. Here you have a couple disc spaces here and there, just not quite equal. But I know we can definitely bring you from phase 2, 3 into normal. We've had many patients here totally recover. So the one thing I just want to remind you is that this isn't going to happen overnight. It's kind of similar to going to the gym once and expecting to lose like 50 pounds. It's just not going to happen. It's going to take a little bit of time. So we're just going to discuss the treatment plan later on and see how many times we need you to come in. But as we move down here into your lumbar x-ray where you're having some pain, you can see that the bodies have degenerated just a little bit. They're not quite even, and the disc spaces are a little bit different, so this can definitely be compressing. And then falling off that surfboard just gave it that little bit for you to notice that there are symptoms. And then down here in your pelvic x-ray, you're supposed to have both. Do you see these spaces right here?
Yeah.
So those are called our foramen. They're supposed to be equal, but as you can see, your left bone is slightly over the midline, and this is totally compressing any nerves coming out there, radiating down your legs, probably where you're getting what we like to call sciatic pain from. So did you have any questions about your x-ray?
What is this right here?
So that's actually a common question we get. It's actually just an air bubble, so nothing to be worried about.
And then this, I just don't know what that is either.
Just right there. Well, I think that's actually just your butt crack. So it's okay.
That's
You're good. No worries. So based on these 3 exams, what I'm going to say is for the first 2 weeks, I'm going to see you 3 times. We just want to get you out of that initial pain. And then we're going to do twice a week for 6 weeks after that, so that's a total of 8 weeks. Mm-hmm. And then we're going to reevaluate you from there. Does that sound good?
Yeah, sounds great.
Okay, perfect. All right, so next we're going to move on to what we like to call our office policies. So here at my chiropractic office, we do things a little differently sometimes. Every time you come in, we're going to have you go straight to the front desk. You're going to take care of any payments needed, schedule your next visit, just kind of check in with people there. Okay. Next, you're going to take this key fob that I'm going to put on your thing, on your key ring, and you're going to go over and you're going to swipe it, and it's going to tell you which table and which adjusting room you're going to go to. So it's going to be 1, 2, or 3. Okay. And while you do that, it is also sending all your x-rays and all your doctor's notes into that room so that the doctor adjusting you can just pull it up nice and easy, and we don't have to refer to any written charts here.
Great.
The next thing is, after your adjustment, we put most of our patients on our tractions machines, which, as you saw, are just outside in the front on the little room to the side, and you'll be assigned between 2 to 6 minutes. We just like this for after all the adjustments, and if your doctor says no that day that you're not going to do it, then you'll just proceed out. The next thing is we totally understand any emergencies that you have. We ask that you try your best to give us 24 hours notice so that we can fill up your spot, and then we'll work with you to reschedule. The only issue we have is if you miss a couple appointments in a row with no excuses, I'm going to have to bring you back into this office here, and we're going to rediscuss your healthcare plan and see where we want to go from there. Okay. And then here, we also, if you're going to receive a call or anything like your cell phone might go off, we just ask that you place it on silent just so that we just want a really zen atmosphere. Okay. And then as you saw when you came in, right beside Mary's desk, we have a fruit bowl and a fridge. Help yourself to anything in there. There's juice boxes, there's apples, bananas. And then lastly, as you are aware, as I've stated before, we require you to attend a healthcare class. This takes place twice a month, once on a Wednesday night and once on a Saturday afternoon, whichever one works better for you. So which one do you think would be better?
I think I'll probably come to the Wednesday.
Wednesday? Okay, perfect. We actually have that one next week, so on your way out, we're going to get you signed up for that.
Okay.
And last thing, I know you have 2 daughters. They're very athletic. I've heard that
Yes.
they're the stars of their teams. And here, we would love if everyone was under chiropractic care. So even if they're not having any symptoms yet, like I showed you with your x-ray with your very top vertebrae snatching into the top of your skull, you might not see those symptoms down the line, but we would really like to resolve any problems that they could have. So you could bring them to the healthcare class, you could bring them to one of your appointments if they're nervous about coming in and just see how the office is run.
Okay.
And all the kids here under our care are oddly the kids that don't get sick, and they're the ones that perform so well academically, and they kick butt out in their respective sports.
Great.
Okay. And then the very last thing that we're going to touch on is just the financials here. As you know, we do cash or insurance. We like to accommodate anybody as we like everyone to be under chiropractic care. So whichever one works for you, we're going to have you set it up with Mary at the front desk on your way out. Each adjustment's $40. Kids, we have a special rate. Today and yesterday's initial exam total is $100, including the x-rays.
Okay.
And then if this is a problem for you at all, we offer financial plans that Mary, again, she can set up with you. Do you have any questions?
No, I think that's pretty self-explanatory. I think I got it.
Yeah. Any discounts?
Oh yeah, do you offer any student discounts or any past service discounts?
We do. So I know that you're just finishing up your schooling just in the last semester. So we actually offer a student discount at, instead of 40, we bring it down to 35.
Okay.
And then, as I said before, we'd love to have your kids in here. So any of their adjustments is $25 versus 40,
Great.
which is great.
Yeah, what about referrals if I have some friends come in?
We love everybody to bring people in here, whether it's to the healthcare class. Again, they could come watch your visit. But what we do here is that if you refer 2 people within 1 month's time frame and they do come in for care, you receive a regular $40 adjustment for free.
Great. Wow, that sounds awesome.
Yeah, exactly. So everything else sound good?
Yeah, I'm ready. Definitely ready to go with this.
Perfect. Okay, so I look forward to working with you, and I'm going to just take you up to Mary, and we'll schedule your next appointment.
Great. Thank you very much.
Thank you.